very aggressive lead laws. And so when my blood work came back, the lab contacted the state, who then notified my parents, got a lead inspector out right away to identify where the lead hazards were, referred me to the lead clinic at Boston Children's Hospital. I was on chelation therapy for 4 days, and then I went home, and I've been healthy ever since. But I was really lucky at the same time, because my state at the time did not have universal testing. So they were only testing children in high-risk areas, which I was not in. I happened to have a pediatrician who worked in Boston for a long time and saw so many children with lead poisoning that he just tested his patients. I just think about that sometimes, and it just like kind of blows my mind. Like, I was so lucky that I could have had permanent brain damage because the levels were so high. And one of the scariest things about lead poisoning is that there are no symptoms. So even at 67 micrograms per deciliter, my parents had no clue that there was anything wrong with me. You only know a child is poisoned if you do a blood test, which is a very simple test and very inexpensive test. And you'll only see the symptoms if it's too late. And as I mentioned, they are irreversible. I cannot say enough that we need universal testing so that children who are not necessarily considered high risk, like myself, don't fall through the cracks and suffer decreased intelligence, behavior, and behavioral health issues. And many states still don't have universal testing. We also need to fund the Healthy Homes and Lead Poisoning Prevention Program at the $35 million in fiscal year 2017 for surveillance in all 50 states. The surveillance data is essential to federal, state, and local efforts to identify and screen at-risk populations, target HUD grants, and primary prevention activities, monitor trends, and evaluate interventions. And it helps us to assure that poisoned children's levels are going down, and it's essential to prevent instances like Flint from occurring in the first place. It also, as you mentioned, the return on investment is really good for these programs. It's great business. It's a range of $17 to $221 per dollar invested in lead hazard control. So in Baltimore City, where I work, as with the rest of the country, we've made great strides in reducing childhood lead poisoning. In Baltimore, we've had an 86% decrease in the number of children with elevated blood lead levels between 2002 and 2012. We've done such a good job that the funding has actually decreased. But we still have a lot of children at risk every day. It's not gone. In Baltimore, we still have an estimated 56,000 children under the age of 6 that are at risk for lead poisoning. In the United States, we have over 500,000 children in the U.S. with blood lead levels over 5 micrograms per deciliter. And as mentioned, almost 24 million homes in the U.S. with significant lead-based hazards. Childhood lead poisoning is considered the most preventable environmental disease among children, which is kind of crazy, but we can end it. So we can end it in our lifetime. And investing in these Healthy Homes programs is what we need to do to put an end to childhood lead poisoning once and for all. And that is what. Thank you.